friends, my name is Dr. Rekha and I am vitreoretina surgeon at Swami Vivekananda Netra Mandir, Surat. So today we'll be knowing about what is ROP, that is retinopathy of prematurity. So this is a disease which affects the retina of a premature child who is born at less than 34 weeks at birth or whose birth weight is less than 2 kg. So when a baby is inside the womb of a mother, this is how the eye forms. In front we have a transparent layer which is called as the cornea. In between is the lens which is also transparent, and behind is the retina. From here the blood vessels start growing up, and if the baby reaches the term, that is 40 weeks of gestation, these blood vessels will reach to the end of the retina which is called as the ora serrata, and this baby won't have any issues. But when the baby gets born at less than 34 weeks or a baby is a premature, these blood vessels will stop somewhere in between like this. Okay. So if we have nearly 100 babies, out of them 60 to 70% of babies with the increase in age and increase in weight, these blood vessels will reach forward and they won't face any problem. But in 30 to 40% of these babies, there will be a formation of a wall in between, which is because of the disease called as ROP. So what this wall will do, it will not allow the blood vessels to move forward. And in some of the cases, there will be formation of abnormal vessels within this wall, and these blood vessels will create a pull over the retina and will create a complete retinal detachment, which is called as stage 5 of ROP. Once a baby reaches to this stage, the baby becomes blind for the lifetime, and despite of surgery, they cannot save the vision in these children. So what can be done for this? What we need to do is we need to screen these babies on time. So when the first screening has to be done, it has to be done within the 30 days from the birth. We call it as 30 days of vision in these babies. And how the screening has to be done? There are two methods of doing a screening. The first method is to screen the retina of these babies by a vitreoretina surgeon who specializes in ROP. And the second way is there is a specific camera which is designed to capture the images of the retina of these babies. And by that screening, we come to know how much the blood vessels have reached, whether there is a disease or not, and accordingly it is decided whether we need to follow up that baby or not, and accordingly the follow-up given to the baby. And once it is detected that the baby is in this stage 3, we need to treat this baby. And the treatment is very simple. There are two forms of treatment. The first is the laser and the second is the injection. And by timely treatment, the quality treatment, there are 99.9% of chances the baby will remain stable, the retina remains stable for the lifetime, and the baby can see this beautiful world like a normal child. So let's come together and take a pledge that we won't allow any baby to go blind due to ROP. Thank you.
हम आपको भी इस उम्दा प्रोजेक्ट दिव्य दृष्टि में जुड़ने के लिए आमंत्रित करते हैं। आप किसी भी तरह की सेवा के हेतु हमसे जुड़कर इस अभियान में अपना योगदान दे सकते हैं।